Hello, my name is Dr. Farman Ali and I'm a GP, family physician. So how do you diagnose blood pressure? Remember, a one-off high reading is not a diagnostic of having blood pressure or hypertension. So when you take your blood pressure, you usually come with two figures. For example, I took my blood pressure earlier today and it was 126 by 77. The top figure is called the systolic, and this is the measure of the pressure inside your arteries when your heart is pumping the blood out. The lower figure, the diastolic pressure as it is called, is the pressure inside your arteries when your heart is relaxing between beats. The third number is the heart rate. It was at 90 beats per minute. It is usually less than that, but maybe I was a bit nervous. As we said, a one-off blood pressure reading that is high does not mean that you have hypertension. Your blood pressure varies throughout the day. It may be high for a short period of time if you are anxious, stress, pain, or if you have been just exercising. So what happens in the home blood pressure monitoring? You can monitor your blood pressure and record your blood pressure for 7 consecutive days at your home. Now, on each day, you take 2 blood pressure readings, one in the morning between 6 a.m. and midday, and another one in the evening somewhere between 6 p.m. and midnight, usually 12 hours apart. On each occasion, you will take 2 readings, one after another. Give a minute or so in between these readings. Record these readings on a piece of paper, or you can download the chart from many different websites and drop these readings off to your GP. So once you have dropped off these readings to the GP practice, they will take an average out of the blood pressure readings, and if the average is high, they will contact you to diagnose you with blood pressure. If we go back to the diagram, if your blood pressure is less than 140 by 80, you do not need to do anything. Recheck it in 5 years' time. If the blood pressure is higher than that mark, you may be asked to go and do some home blood pressure monitoring. Again, if it is less than stage 2 hypertension, you do not require treatment unless you have got some underlying health problems. If the blood pressure is more than 180 by 120 on repeated readings in any settings, treatment is commenced straight away. So what are the targets for optimal blood pressure? This is the most commonly asked question, and patients will ask, what should my blood pressure be? Remember, if you are below the age of 80, your blood pressure in the clinic should be below 140 by 90. If you and your home blood pressure or ambulatory blood pressure should remain below 135 by 85. Those patients who are above the age of 80, their clinic blood pressure should be below 150 by 90, or their home or ambulatory blood pressure should be below 145 by 85. Thank you very much.